So you are actually putting in implants and then giving them the teeth the same day, which I guess isn't how it's normally done. So tell me about your process, this same day teeth with implants process.
First of all, I'm using my system that is very, very suitable for immediate placement. In other words, when we place it, it goes as hard as 80 Newton centimeters. So it's very stable.
Okay.
And then when we put multiple of them, like 4 to 6 of them, with the technique that we have, we connect them securely to each other on the same day. So we can actually give them the final teeth same day. Nowadays, what we do is the patient comes in, once they decide to go with this system, we make impression, we choose the teeth that looks nice in their face, we choose the color that is age appropriate or whatever they want. Sometimes, ladies want a whiter teeth and that's what they get. And we order the teeth, and the lab would make the base of the dentures with the teeth on it. I get a look at them in advance to make sure that the teeth are placed in a way that is suitable for this patient. And then the patient comes for one day in the morning. We sedate them, any remaining teeth, take them out, place the implants, and the final teeth are already done by the lab, and we fix the final teeth on those 6 implants.
Okay.
That same day.
That same day. So how's it normally done?
Well, normally, patient goes to the dentist and says that they want fixed teeth on full arch of implants. So the dentist, typically they don't do their own surgery, they send the patient out to an oral surgeon or a periodontist. They get evaluated for implants, 2 or 3 visits goes into those evaluations, records, x-rays and all that. Then ultimately, okay, they go to the periodontist or oral surgeon, get all the implants done. Then they go back to their regular dentist and they get a regular denture put on. So the patient has to wear that regular denture for 3 to 6 months.
While the implants are what?
While the implants
bone
are
is
healing.
grabbing onto the...
Yes, under the gum.
Okay.
The implants are not exposed. The implants are now under the gum.
Okay.
And they're healing while the patient is wearing a denture. And then after the patient wore the denture for 3 or 4 months, then they go back to the surgeon. The surgeon will open up the gum and put the little stubs on it so that it'll stick out of the gum.
Okay.
Then the patient waits 2 or 3 weeks. Then they go back to the regular dentist, and the regular dentist will start the process of the final prosthesis,
to put the teeth
which
on
is
top.
to put the teeth on. And the teeth are screwed onto those implants. And a lot of problems and disadvantages with using the screws.
But that's how it's done like 95% of the time across the country.
Definitely. That's how I did them till 7, 8 years ago.
Okay.
Okay. I have a lot of patients who have that system in their mouth, and it was very tedious to do it. It ended up being very expensive for the patient because we spend so much time chairside doing it.
So the way you do it now is what? If everything works out?
The way we do it now is patient comes in, decides to go forward with this kind of treatment. We make impression of it. I told you we choose the teeth that is appropriate for the patient. Patient goes away and shows up only for the day of surgery. Meanwhile, the lab has made the final teeth. They have shown it to me before they finalized it. I've made sure it's the right arch shape, right color teeth and all that. Then when the patient comes for the surgery, one day we sedate them, we take out any remaining teeth, we place 6 implants, and same implants, we put the stubs on top and fix it with that final teeth in their mouth. So when they
So in 2 appointments?
2 appointments, the first one being the initial consultation.
And the second one, they get their teeth?
Yes. One session of, this is truly teeth in a day. This system of doing 6 implants in an arch with the teeth that are made in advance is a true teeth in a day system that we do it at least a couple of times a week nowadays.
Now, because you're the manufacturer, you teach dentists from all over the world how to do this procedure.
Yes.
Is it more to go to you?
Is it what?
Is it more expensive to go to a guy like you?
Not at all, because I do it so much that I do it with much ease and with less effort.
Are you
and
less
I'm also
than the national brands?
Yes, because I'm also the manufacturer. I don't know any other dentist who is also a manufacturer of the hardware that they use.
Okay.
I'm the manufacturer. We sell all over the country, all over the world, in fact. Next week, I have a class that people are coming from all over the country to learn this technique. 2 weeks from now, I'm going to Asia on a tour of teaching this stuff to the other dentists throughout Asia and Middle East. So, yes, I'm.
So
you know,
this is
I
called
do it.
immediate loading. That means you put the implant, put the tooth on top the same day.
Yes, yes.
So even if I have guys that come on my show and say, Randy, that's really not possible. They just
Well,
don't have the
they
education.
they're welcome to come
go
to
to
the
your course.
office and they'll look at it or come to the office. Yeah.
So you're
And
doing it every week.
at least twice a week. Yes.
Okay, good.